I'm Stacey Henley, and I'm a forensic nurse and the nurse manager of the C.A.R.E team at Cook Children's Medical Center. At the C.A.R.E team, we provide medical evaluations for children where there's a concern for child abuse. So if there's a concern for physical abuse or sexual abuse or neglect or drug-exposed kids. And so we may do forensic medical evaluations, or we may do imaging or lab work to make sure that those kids are safe and medically cared for, and that they can receive the care that they need. It's hard to determine how common human trafficking is in minors because children don't report. Other people don't report, bystanders don't report. People can't identify it. They're not familiar with what it looks like. They may see a child but not think that that child is being trafficked because they don't look like what they think they should. And so that includes healthcare professionals, it includes law enforcement, child protective services. They just don't have that knowledge to know that that child's being trafficked. Signs of human trafficking in children is kind of tricky. Sometimes we have lists of red flags like tattoos. The child's not wearing appropriate clothing for that season. They might have items that are very expensive that they wouldn't have the money for. So we see things like that in our red flags lists, but that's really not a good barometer of if they're being trafficked or not. Really the best way to determine is what the child says. And that's also not very good because they don't identify as being trafficked. At Cook Children's, we do have a screening tool. And in that screening tool, we have a list of things that are high risks for trafficking. So running away, if they've ever run away before, or if they're homeless, if they have been strangled or knocked unconscious, have had some sort of physical assault, if they have done drugs or alcohol use in the last 12 months as part of the screening process, and how many sexual partners that they have had, and how many, if they've had any sexually transmitted infections, if they've had any involvement with police. And those are 6 things that we ask about, but if it's a positive screening, doesn't necessarily mean that child has been trafficked. But it means that they're high risk. And so we would give them resources, and we would connect them with people that could help them to get the things that they need so that they aren't trafficked. If you do suspect that a child is a victim of human trafficking, you have to be very careful. You have to be careful for yourself, but you also have to be really careful for the child. Because of the manipulation and the grooming that's involved in getting children into trafficking, they don't identify as being trafficked. And so they are not going to understand what you're doing. The most important thing, I think, is to report it, to get authorities involved. You can call the C.A.R.E team if you're in the Fort Worth area or surrounding counties. You can call other medical teams if you're in a different city. You can call the law enforcement. You can also, if you don't know what to do, you can call the National Human Trafficking Hotline, and they will get you resources.